Everyone knows who I am, Jessica Schull. I'm based in Barcelona. The DTA, the Digital Therapeutics Alliance, is a global organization headquartered in the US, but we do work all over Europe, Australia, Japan, South Korea, and now Latin America. So the digital therapeutics landscape is definitely global and expanding every day. So I want to first talk a little bit about what digital therapeutics are, just because that is always our first point of departure. And I think the term is used for different things, but we try to ensure that everyone understands these are products that actually are, excuse me, an intervention. And so I think that what Scott was presenting just now are, these are the products that he's talking about, or his product is very useful and important and can be used in many ways, I think, to help healthcare, especially, for diseases like diabetes. But we would not particularly say that this is a digital therapeutic, only because a digital therapeutic would have to have an actual clinical trial with the digital therapeutic as the control against the standard of care, and having an actual clinical endpoint proving that the software had acted in an intervention to improve the outcome. So in a clinical trial with a digital therapeutic for diabetes, you would have improved HbA1c after 3 months or 6 months. And there are products that have done this, and they are reimbursed currently in Europe and being paid for in the US. And so this is something very specific. It's a niche sector of the digital health broader landscape. And so a very simple graphic trying to illustrate here, everything could be called digital health. So here you have things that are lifestyle apps and fitness trackers that can make people feel better. Yes. Health information technology, telehealth, telemedicine, all of these, remote consultations. This happens in the broader digital health. These are not medical devices. In digital medicine, you have things which are digital biomarkers, remote patient monitoring, medical adherence tools, and these may or may not be medical devices. They often are, and follow their own requirements for regulation. More specific and at a higher level of rigor in terms of regulation and clinical evidence required, in the center here is digital therapeutics, where they're actually making a medical claim to treat, manage, or prevent a disease, to prevent actually the worsening of a disease. So this is just a graphic that we've designed in conjunction with a few other organizations around the world to try to categorize the kinds of products that are available right now, because across the spectrum there are a huge number, and we want to ensure that the products in the industry that we work with adheres to the highest level of evidence possible, so that we have the recognition and the credibility across healthcare systems globally. And just quickly, these are, if you can see, the 10 principles which we ask all of our members to adhere to. The first being to prevent, manage, or treat a medical disorder or disease. Then that treatment should be a medical intervention that's driven primarily by software, incorporating design and manufacture quality as practices. This is including patient privacy, cybersecurity, all of the things that were mentioned previously, which, it's always a question, but I have to say there are standards in place for this. And they aren't always the same standards, but there are ways to ensure that privacy and cybersecurity are there, and these products can function safely. So digital therapeutics products are in use in at least 15 countries around the world. And frameworks are being developed every day to adopt more of these products. And it's something that I think Julia and Javier later in our panel can speak to directly. In general, these are products that can be an M-Health product. They can be on a mobile phone. They can also be on a computer. They can be on a tablet. And so the terminology has become a bit let's say, mixed up a bit, because there is no one way to look at these products. I mean, they are digital health, but they're also mHealth, and they're also digital therapeutics. And so I think understanding all of these terms in a way that healthcare systems can understand is very important. And we see, I think when I started out in digital health 20 years ago, there was eHealth, and I worked with WHO for years on projects called eHealth. And at that time, it was about getting electronic patient records into the hands of patients or physicians who had paper only, that kind of thing. But we're now looking at eHealth as telemedicine, and then digital therapeutics can actually be prescribed through telemedicine, especially during a pandemic, and be a very useful additional tool for physicians to use when you can't have face-to-face consultations. So I'll stop there.
Jessica, thank you. Can I ask you? I'll jump in before you stop. Jessica, just I want to ask you a question, because you see a lot of what's being developed around the world. Who do you see as being the developer? Is it med tech companies in some respects, like say Medtronic, that is big in the space of we're talking around diabetes, or Roche Diagnostics, or do you see it coming from smaller startups, or even do you see it an IBM and Google and Microsoft, the big tech companies? I mean, we sort of approached it in a certain way. We approached it from a tech angle. We can do everything with data, sort of thing. What do you see? What's the market? What's the landscape from that respect, and what have been the hurdles?
Right. So I think we're seeing these products being developed everywhere. So surprisingly, not as many tech companies as you would think. Philips is a member of the DTA. We have a lot of pharma companies, and they are invested in products, and also helping us structure the ecosystem, let's say. Also small DTX companies, also research institutions, universities across Europe, also in places like Singapore, medical schools. So I think the one thing to keep in mind for any company approaching this, big or small, and this goes from big pharma to Google, it doesn't matter what kind of company it is, you have got to involve the clinical side and the way that patients interact with clinicians. And that, I think, is where companies like Amazon and Google haven't really done as well as smaller companies. And so they're learning, of course, everyone is, but that has been one of our big efforts now, is to involve physicians not only in how these products can work, but just understanding what's most useful for their time and the way that they work, and what impacts their day. Because especially now, I mean, you can't give a respiratory specialist a new device that takes 3 weeks to learn and 10 weeks to have results. And so, but anyway, I can go on a long time about this, but that's the basic.
I think speaking from the perspective of IBM, we could have a whole session on what our learnings are around all this, what's worked, what hasn't worked. It's a whole area. It's an interesting area.